let's dive into lateral walks, monster walks, and banded tap backs. These are great tools when you use the band to work on those glute meads. The glute meads are a big hip stabilizer. I'm Dr. Nichelle Gurley, and I'm specialized in prenatal and postnatal movement. So what you're going to do is you're going to take the band, place it above your knee, and for lateral walks, and actually all of these, you're gonna give a slight athletic knee bend and then a little bit of a hinge in your hips. So what I mean is that you're not gonna be stiff like this. You're gonna add a little bit of bend to your knee and a little bit of a hinge. So we're not bending like this, nor are we bending our knees like this. It's just a slight give of those knees so you're not stiffened out. So with that being said, slight athletic knee bend, a little bit of a hinge of the hips. And then what you're going to do with the lateral walk is step out and together, out and together for however many reps are prescribed, and then back the other direction. For monster walks, you're doing the same thing, but you're going at a diagonal forward or backwards. So a monster walk is going to be out together, out and forward together. You can skip the together and just go out, kind of swing it through, out, swing it through, out, and then backwards, same thing. You can go out, together, out, together, or you can swing it where you go out, 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 and you don't really bring that together. So you have lateral walks and monster walks, and then another option are banded tap backs. So I'm going to go from an angle here to show you. So you're going to press actively out against the band and tap back. You can tap back to the side, tap more directly back. What this is good for is that stance leg is really working that glute med, the big hip stabilizer, but then this leg is also really working, but in a different way, because this is more of the worker leg. So this is more the stability leg. This is the worker leg. The more out you go to the side, the diagonal, the more the glute med you're gonna get. Then if you go directly back, that's gonna get more of the big muscle, that big glute max there. So to work on the glute med to help with pelvic and hip stability, you are going to utilize, as long as it doesn't hurt, lateral walks, monster walks, and then banded tap backs. All of these, you're thinking about your outside of your knee is driving out over your pinky. You're putting pressure into that band so that band is stretched, and that's really where you're gonna get a lot of that work on those glute meds.